Hello, I'm Whitney Ortiz with Eliana's Light. Eliana's Light is a nonprofit organization that supports integrative medicine and complementary therapies for children with complex medical conditions and also their caregivers. Thank you for joining us for this conversation with a caregiver. We're very grateful to have with us Dr. Ann Berkeley, who is a board-certified and licensed naturopathic physician who has a practice in Washington, D.C. Thank you, Dr. Berkeley.
Great, I'm happy to be here today. Today we're going to be talking about 6 stress relief techniques for caregivers of children with complex medical conditions. And we're going to be talking about stress and the effects that stress has on the body, specifically for those who are experiencing medical traumatic stress, which can be experienced by caregivers, but also by kids themselves. So when the body experiences stress, cortisol, which is a stress hormone, is released and a response system is activated in the body. You may notice that when you feel stress, you feel your heart beat faster, the pupils in your eyes may dilate, you may experience quick, deep breathing, your digestion may slow down, and saliva can decrease, but also your muscles can become more tense. Stress over a long period of time can decrease your body's resilience, which is your ability to bounce back from stress. For example, your immune system slows down, so you're more likely to become sick after experiencing stress.
And if you are a caregiver of a child who has a complex medical condition, you know you do not have any time to get sick. And you're probably running through examples in your own mind about how you experience stress directly.
Let's start talking about techniques that can help to decrease the effects of stress on the body. The first technique is focusing on your breath. And focusing on your breath is one of the quickest ways to reset your body's response to stress. A technique that I like is belly breathing, and this can be done by placing one hand on your stomach and one hand on your chest. You breathe in through the nose and feel your stomach push out while your chest doesn't move. And then breathe out through your lips and feel the stomach pull in. You can also count to 4 on each of the breaths, and this can be repeated. The second technique that we're going to talk about is focusing on your nutritional intake. During chronic stress, your appetite can increase, and people tend to crave comfort foods, which can decrease your body's ability to protect itself from stress. Foods that are high in B vitamins can be helpful for your body. These include eggs, grass-fed beef, poultry, leafy green vegetables, lentils, split peas, and asparagus. Also, foods that are high in omega-3 fatty acids, like wild-caught fish, including salmon or sardines, walnuts, chia seeds, and flax seeds, can also be helpful. You can talk with your doctor about if supplementation is something that would be helpful for you, and you can specifically ask about a multivitamin, a B vitamin complex, or fish oil. If you're working with a naturopathic doctor, you can also ask about cortisol testing and botanical medicine that can help the body deal with stress and recover from the effects of stress.
Mm-hmm. And I know from myself personally, I am much more inclined to reach for ice cream than a salad when I am in a very high stress situation or always stressed. And so it's really something that you have to put your mind to say, I need my body to be working the most effectively that it can so that I can help those who need me. And if I'm run down, if my body is depleted, I'm not going to be able to do that. And ice cream is not going to sustain me like the salad can. And you all know whether you reach for the sweet, the savory, the greasy, what have you, And that's okay, of course, every once in a while, but be mindful of it and know that that may be detracting from your ability to be the strongest and best that you can for those who need you. And what about snacks, though, as I'm thinking about this? Is there anything that you would recommend that makes things easy for those, including caregivers who are working in a hospital or who are with their child for a long period of time in a hospital?
Mm-hmm. Yeah, you can talk with your doctor about some snacks that may be helpful for your body, and this may include some cut up vegetables or fruit, maybe a packet of nuts, or even some protein bars, which can be bought from a health food store.
Mm-hmm.
The next technique that we're going to talk about is focusing on exercise. Even small amounts of exercise can help your body to manage stress. And exercise doesn't eliminate stress, but it can help to give your body the physical conditioning that your body needs to recover from it. Some ideas that may be helpful are choosing to take the stairs, walking the hallways, and getting up to stretch. These are things that can be done in a medical or a hospital setting.
Mm-hmm. And even if you're just having to sit all day, or if you've been lying and sleeping on a hard couch for many days and weeks, etc., even if you just like sit up strong, take a look over your shoulder, stretch your back out, maybe try to reach for your toes, or put your arms out on a bed and stretch your back out, all of those little things can sometimes make a big difference.
Mm-hmm. You can check with your doctor and see what kind of stretching or movement or exercise would be best for you. The next technique is focusing on nature. And spending time in nature can help to boost immunity, improve mood, decrease blood pressure, and help to reduce stress. And some ways that this can be done in a medical or hospital setting is by going outside and walking around the building if you can, finding a window with an outside view, and if it's possible, to put feet on bare grass. The next technique is focusing on social support. The role of family, friends, and social networks are important, and leaning on loved ones can provide support in stressful times.
Mm-hmm. And say yes when somebody offers you support. And sometimes they really want to help, but they don't know how. Like, what is going to work best for you? So be very clear and do let them know what is going to be helpful to you in the situation that you're in.
And finding social support really can make a difference. There was an interesting study that was done, and it took university students who stood in front of a steep hill with heavy backpacks. They had to imagine climbing that hill, and they would guess the incline. They found that when a student stood alone, he or she tended to guess that the hill was very steep. But when the student was standing next to a friend, the hill didn't look as daunting. So students standing with a friend consistently gave the lower estimates of the hill's incline compared to the students that were alone. And a conclusion that can be made from this study is that having a friend or family member by your side can help make the world look less challenging. The last and next technique that we're going to talk about today is focusing on yourself. And this sometimes can be very hard. Knowing that self-care is not selfish is something that can be important and helpful. Taking care of yourself can help make it easier to care for others. And keeping your cup full helps you to be able to give to others.
Mm-hmm. And as a mother of a child who had a complex medical condition, I know that it was not easy to consider myself as a priority, but I do recognize that when I was or I am in a place of greater balance, I'm also in a place of greater strength. And from that place, which takes positive intention, constant effort, you are able to help others better. So it is actually a really good thing to focus on yourself, and self-care is important. If you would like to learn more about Eliana's Light, we invite you to visit our website, www.elianaslight.org. And we also invite you to visit Dr. Berkeley's website, www.medicinetothrive.com. And Dr. Berkeley, would you like to share how people can work with you and learn more about your practice?
Yeah, you can go to my website and learn more about my practice there. I offer a free 15-minute consultation for new patients, which can be scheduled by calling my office. And I also have a free ebook for download on my website.
Thank you, Dr. Berkeley, for all your time and really practical guidance. And thank you all for joining us today.
Thank you.